Broadcasting from Manhattan Beach and the World Wide Web, you're listening to CHSR, HealthyLife.net.
As a service to our listeners, this program is for general information and entertainment purposes only. CHSR HealthyLife.net does not recommend, endorse, or object to the views, products, or topics expressed or discussed by show hosts or their guests. We suggest you always consult with your own personal, medical, financial, or legal advisor.
It's time now for the Patty Conklin Show, exclusively on HealthyLife.net radio.
Okay, folks, it's Frenesa K. Hall, MD, as Patty likes to say. Patty is covered up busy, and so I have my special guest today, my dear friend Martha Boone, MD, award-winning urologist, author, and just one of the smartest people I know. And Martha, thank you for agreeing to be on the show today.
Thank you for having me. I hope we're going to have something interesting to say.
Well, I know you do. You have lots of interesting things. It's too bad we don't have more time, but so, you know, urology is still a very male-dominated field, and you've just recently retired from how many years in practice?
35 years of practice.
Wow. So let's talk about, as you've talked about in your books, folks, if you want to have a good laugh and a fun read and get a little insight into surgical residency, Martha has written a book called The Big Free, and it is absolutely hysterical. But just for our purposes here, since we're going to be more serious and talk about urological things, let's just talk about your training, because, you know, it takes a lot to become a surgeon, and certainly a subspecialist surgeon. So where'd you go to school? Where'd you do your training? I believe you've done some extra training on top of your urology. So give us your sort of background.
I was one of those crazy kids who just really loved school and loved learning. So I did the 4 years of college, 4 years of medical school. Then I did 2 years of general surgery at Tulane. I did 4 years of general urology at Tulane. And then I did a year of urinary tract reconstruction, which is just kind of the biggest surgeries that we do, like making a new bladder for someone out of bowel if they had bladder cancer and had to have their bladder removed. So my crazy self did all those years of surgical training to get to be a urologist. And I think most people think that a urologist is somebody who just sees patients in the office and, you know, checks their urine and stuff like that. But we're actually a surgical subspecialty.
Yes. Yes, and actually, you probably don't know this, but when I finished medical school, the two things I came down to deciding between were urology and primary care. Because urologists, you know, yes, you're in the office, you do have relationships with your patients, and the office is a significant part. You're not just in the OR. So just fun fact, but that's a lot of school. I mean,
it sure is. I think you would have been a great urologist, because it takes a thick skin and a sense of humor in addition to eye-hand coordination. And since you are such a good guitarist and you have definitely a thick skin and definitely a great sense of humor, I think you missed your calling, my dear.
Now, wouldn't that have been funny if you and I wound up in practice together?
Oh, well, we would have had some fun.
Well, we would have had so much fun. So, you retired. You were in practice in Atlanta. You were top urologist. You got that award how many years in a row?
13, which is kind of amazing. Atlanta has a great quality of urology. We have just a plethora of really good urologists in Metro Atlanta, and they kept voting for me year after year, which is a huge honor.
Yes, and it's their loss that you retired, but of course I get it. And you retired. You've done some traveling. You wrote The Big Free while you were still in practice, right?
Yes. Hurricane Katrina destroyed Charity Hospital in New Orleans, which was one of the most important places for 6 years of my training. And my one of my many mentors at Tulane was a world-renowned trauma surgeon named Norman McSwain, and he and I were both devastated that Charity was not going to be, a functional hospital again. And so I had been writing stories to him about things that had happened to us at Charity, and I've been doing that probably for about 15 years. And he just really insisted that I write a book. He said, somebody's got to memorialize that hospital because it was such a special place. And so I wrote The Big Free, and then I wrote the sequel to it, which is Mother Charity. But I would get up at 4 o'clock in the morning and write until 5, and then I would exercise, and then I would go to the hospital. Now as a retired person, I can't believe I was that maniacal, but that's how I ended up writing the book. My old boss was forcing me to, and then I just got up at 4 a.m. instead of 5 a.m.
Wow, 4 a.m. That's amazing. And then you retired, and you wrote this book, The Unfettered Urologist, What I Never Had Time to Tell You in a 15-Minute Office Visit. And you sent me a copy. I've got my autographed copy right here. And, I wish I'd had this book when I had my primary care practice, because there's so much information that's useful to help get things going in a workup or things to do to help patients with common urological issues before sending them on to the urologist. And so I believe that we are cut of the same vein in that we understand that talking to our patients and understanding them, getting to know them, builds the trust, and that the current medical system makes it really challenging to do that. And you wind up having to see volume, and so I can empathize with this title because it's just devolved into a situation where you just don't have the time that we used to have. Even when I first went into practice in the early 90s, I had time to sit down and talk to people. And so you wrote this book, really for your patients. How did you come? What was there something that led you to say, okay, I need to write this book? Was there some incident or situation or whatever that gave you this inspiration?
Yeah, there were a number of things. I mean, what I thought would happen when I retired is I thought, oh my gosh, there's so many amazing urologists in town. I'll walk out the door and everyone will have forgotten about me in 6 weeks. And I really spent months making sure that my patients got assigned to a urologist that I thought would work for them. I paid attention to what part of town they lived in and the personality of the urologist and the personality of the patient. So I thought I had everybody tucked in tight, and I would just walk off and never hear anything else. And much to my surprise, the nurse practitioners, the PAs, many of the patients would find me through all kinds of maneuvers. And many of the primary care doctors and even some of the urologists continued to call me. And about 6 months into retirement, it was not showing any decrease in the calls I was getting. So I started taking little sticky notes whenever someone would call me and jot down the question. And it started to take a pattern. The urologists were handling the really complex, difficult problems, pretty easily. But what people were calling me about was my experience, my intuition, and they were also calling me because they wanted non-surgical solutions. What could I possibly do besides that? And so they were able to go to the doctors and get prescriptions and tests ordered and surgery set up, but they weren't having the time to understand why they might choose that as opposed to something else. So the book just kind of came together from all the questions that people kept asking me. And I wrote it as a love letter to my patients because I felt like my job wasn't over. I thought if they've still got all these questions, then I need to make sure that they have the answers to all this. And I also started realizing there was a lot of things that were not strictly medical science. And this is something that you and I share in common. I mean, what medical science is based on is a randomized, double-blind, placebo-controlled study, which is very expensive to run. But then all of us who've been doing this for a while, we have this fund of knowledge that just comes from our experience. And so much of it is intuition, things we've learned from other, doctors, things that we've actually learned from the patients. And so I wanted to include those things because they're not necessarily covered under the role of an average urologist because we are surgeons. We're not people who talk about the connection between meditation and the mind or any of those other things that are so important. And so I wanted to include that stuff also.
Yes. And, that's a funny thing. You said that, urologists aren't talking about meditation and those things. And that's just another place where we've connected in that sort of spirituality, intuition kind of space and, really considering all of the options that are available and recognizing that surgery is effective, but, surgery is cutting someone, and then you have to deal with their whole healing process, and so certainly makes sense to be able to offer non-surgical solutions first, as opposed to going to surgery. So what were the different issues that your patients reached out to you for help for? Were there things that were recurrent?
Yeah, and that's what the whole book is about. They wanted deeper explanations. In a short office visit, the doctor has time to look at the blood work, examine whatever part of the body is involved with the complaint. And then a conventional doctor offers, hey, you're fine, you don't need to do anything, so they reassure you, or they give you a prescription, or they say we need more testing in the form of, blood work or something that needs to be done at radiology, or, with a surgical subspecialty, you go, hey, here's what we need to do. We need to do in the operating room. And so I realized that a lot of people wanted to know, well, what else? Is there anything else I could try? Or are there any non-conventional treatments that we could try? So it was more, what do you have to offer that's not so drastic? Seemed to be a recurrent theme.
Yeah. So, as a primary care doctor, I certainly saw a lot of the common urological things. One of the things that I know from working in life insurance medicine and just seeing records over and over again, that prostate cancer is common, and it has evolved over the years as far as these recommendations. I would imagine that prostate cancer would have been something that patients would reach out about because, that PSA elevation, scares people, but the elevated PSA isn't diagnostic of prostate cancer. One of the things that I've found reviewing records is that so many doctors don't do a digital prostate exam anymore. So talk to us about elevated PSAs, when to be concerned, is the digital exam even recommended anymore, and what are things people can do to mitigate their risk, if anything?
I think the first thing, the answers to these questions are very complicated, and the urology community and the primary care community don't have the same recommendations, so that's one of the problems. To give you the historic perspective, I believe that urologists as a group have in the past over-treated prostate cancer. So there were men who had prostate cancer, and some of the treatments that we initiated were worse than the problem. Historically, if a man lives long enough, let's say he lives to be 85 years old, he's got an 80% chance that there's some small focus of prostate cancer in his prostate. Does that need to be treated? No. But let's say you're a 45-year-old man, and men in your family have had prostate cancer. You need to be screened aggressively because you're the kind of person who could actually die of prostate cancer. So it's a very complicated disease to take care of. And I think, first of all, men need to know what risk group they fall into. So if you're African American, then you have a greater likelihood of getting prostate cancer, and you have a greater likelihood of having the more aggressive forms of prostate cancer. So any African American man who has a father, a brother, an uncle, a grandfather, or multiple people in the multiple men in the family who've had prostate cancer needs to be screened probably by age 45. If there's absolutely no family history of any prostate cancer, then probably between 50 and 55, just depending on what their general health is. Now, what is a PSA test? It stands for prostate-specific antigen, and it's just one of many cancer markers that doctors use. And all cancer markers are imperfect. They need to be used in the context of everything else that's going on with the patient. And with the PSA, it's best as trended data over time, and that's just fancy doctor speak for you check it every year, and you're looking for it to be trending up. So a specific number is not anything to freak out about. Let's say your blood PSA, the first time you ever had it done, is 4, and then you have it done year after year after year, and it stays at 4, then that could be normal for you. Let's say your number was 1 year after year after year. It was 1, and all of a sudden 1 year it was 4. So that's either a lab error or it's a significant data point, and so you would want to have your doctor repeat that, and by all means be sure that you see a urologist if it is indeed a bump in the number. So a lot of the people who have been against using the PSA blood test is because they don't really understand how to use it. And in the past, urologists have probably overused it. But our practice guidelines have come out from our national organization, which is the American Urologic Association, and we have become much more conservative, I would say. So I think that the use of the test has come more in line with the best treatment for the patient, which was not necessarily in the past. And, urologists didn't mean anything to harm the patient. What the thought was that if you have any foci of cancer, then we want to be very aggressive because we want to get it out and we want to stop that. And it took us about 10 or 15 years to realize that some of these patients were going to be able to live okay with a low-grade, low-stage prostate cancer. And so it really is a very complicated disease to take care of. The other thing for patients to know that would put them in a high-risk group is if the ladies in their family have the BRCA1 or BRCA2 gene mutation. And what that is these BRCA genes are there to repair DNA. And so if the person has an aberrant gene in that area, then they're less likely to be able to repair DNA problems. And so as far as prostate cancer goes, the BRCA2 gene mutation is very, very important. And so a man who has a first-degree female relative with a BRCA2 mutation has a 6 times greater chance of prostate cancer. So
did you say 6?
Yeah, well, it's 2 to 6, but,
wow.
I guess I'm supposed high number. 2 to 6 times greater chance of having prostate cancer. So that's an important thing in their history to know, because you want to keep a much, closer eye on that patient. Now, also something that's kind of soft data is if multiple people in the family have had different types of cancer, then the man is at greater risk for prostate cancer. We don't know exactly what that connection is. Being over 50 is a risk factor, And then, interestingly enough, obesity is a risk factor. And the thing that's specific about prostate cancer is in obesity, we have increased insulin levels, which cause all types of tumors to grow quicker. We have chronic inflammation, which causes all types of tumors to grow more. We have increased cell growth, which can cause someone to have, worsening metastasis. And in the male, we see increased estrogen with decreased testosterone, which can cause the worst kinds of prostate cancer. And we'll talk more about that after your break.
Yes. Well, we've that 20 minutes sure goes by fast. Folks, we'll be right back. Stick with us, and we'll continue talking about prostate cancer.
Want to get that man or woman out of your mind? How about being in the right state of mind for getting that job promotion or staying positive to help boost your immune system? Want to break those old habits? Then it's time for an emotional cellular cleansing with Patty Conklin. You'll get a private 3-hour session in person by phone or by Zoom with 3 months of follow-up appointments, plus email support. But you'll have to do the work, and homework materials are included. Find out more or to book your appointment, visit pattyconklin.com. That's pattyconklin.com.
Audiobooks gives you instant access to over 50,000 of the best sellers and hottest book titles in romance, mystery, fiction, and many other genres. Just visit HealthyLife.net's advertiser page and click on Audiobooks to get started.
If you're wondering if Patty can help you heal, why not book a free 15-minute consultation either by phone or by Zoom? It's a great way to see which of Patty's services is right for you. You'll discuss her services in detail and how they can apply to your specific situation. It's really a great place to start, and you can sign up for your free consultation by phone or Zoom on Patty's website, pattyconklin.com. That's pattyconklin.com. Get the help you need today. Sign up for your free consultation at pattyconklin.com.
ASMC, the premier German company that supplies everything for adventure, from outdoor clothes to outdoor gear, even backpacks. Lots of quality and lots of specials. To start your adventure, go to HealthyLife.net's advertiser page and click on ASMC.
Okay, I get it. You're a doubting Thomas, and you don't want to pay for something unless you can know what it's all about. Well, now you can find out just what Patty Conklin's energy healing is all about. Go to pattyconklin.com to sign up for her free group energy adjustment, held every Wednesday from 12 p.m. to 12:30 p.m. Eastern Time. Experience for yourself the transformative energy designed to bring calm and healing to your life. Space is limited, so sign up now. Go to pattyconklin.com, click on Services, and you're there.
Where positive people and radio unite. HealthyLife.net.
Okay, we are back with Dr. Martha Boone, urologist, and we were talking about prostate cancer and that obesity was something that increased a person's risk for prostate cancer, but also risk of recurrence. So let's pick up from there and talk about that more, what obesity is doing.
So I think most people think that those fat cells are just sitting there not doing anything. We think, oh, yeah, I'm a little bit overweight, but what's the big deal? Well, there actually is a big deal. Those fat cells make all kinds of things that are toxic to our bodies. And what's specific to prostate cancer and the risk for prostate cancer with obesity is that those fat cells cause us to have increased estrogen, which in the male is feminizing, and decreased testosterone. Now, it used to be when I first became a urologist 35 years ago, we thought that testosterone caused prostate cancer. Well, it turns out that that's unlikely to be true. And the worst forms of prostate cancer, the most deadly forms of prostate cancer, appear to occur in people who have had low testosterone. So by having excess adipose tissue in the male, we have increased estrogen, lower testosterone, which definitely can affect your erection quality, but also contributes to prostate cancer and the worst type of prostate cancer. We've also seen that in obesity we have those, like I said before, the increased insulin levels, which adds to tumor growth. So let's say you were a man who had prostate cancer, who was caught early. By all appearances, you appear to be cured. If you don't address your obesity or you become obese, you're at greatly increased risk for metastatic disease. So to have the prostate cancer come back. You know, when your doctor has done surgery or done radiation or whatever treatment you've chosen for prostate cancer and your PSA goes to a low level and everybody's celebrating and thinking, oh, great, you know, we've cured this prostate cancer, there's always the chance that there is microscopic disease somewhere in your body. So that's when you really want to address all of your habits. You know, like you and I were talking during the break, you want to be sure your sleep is okay. You want to be sure that your stress level's low. Excuse me. You want to be sure you're eating lots of brightly colored fruits and vegetables. You want to be exercising. You know, all the things that make your general health better will also lower the incidence of having your prostate cancer come back as a metastatic disease. And part of that is maintaining, you know, as best you can your ideal body weight.
Wow. So, you know, when we're looking on the break, you know, the things you just mentioned, sleep, addressing stress, eating a wide variety of fruits and vegetables, many colors, and exercising. I mean, these are foundational things for good health in general, but now you're tying it directly to cancer risk and recurrent cancer risk, which really, I think, highlights just how important our habits are on our overall health and wellness. And so I think this just adds to that understanding and hopefully will motivate folks that are listening to this to, A, go get checked out, and B, really understand that our habits and our weight can have long-term dangerous consequences to our health. So let's go to another topic that I ran into often in practice. It was recurrent urinary tract infections. And it just seemed to be, you know, there was just certain women that just always had a urinary tract infection. And can you talk to me about, you know, what are the risks? What are the factors that contribute to a woman having recurrent UTIs? I mean, obviously there's the anatomy and the proximity of the urethra to the rectum, but why certain people? What is that causes this group of people to have recurrent UTIs?
Well, it's multifactorial. Some people have inherited a type of E. coli called a P. fimbriated E. coli, and it's basically an organism that has these little legs that allows it to track out of the rectum into the vagina, which is a warm, moist culture medium, and then track up into the urethra and really be able to take hold onto the lining of the bladder, and sometimes up into the ureters and up into the kidneys. So this P. fimbriated E. coli, which is inherited, is one of the factors. And multiple countries in Europe have created a vaccine to this particular bacteria. And to my knowledge, it has not been approved in the U.S. yet. But for your listeners who do suffer with chronic bladder infections or kidney infections or both, they definitely want to pay attention to, does this become available in the United States? Because I think that will actually cure a number of patients. But since that has not been approved yet that I'm aware of, what are the other factors? One is not drinking enough fluid. The mechanics of having fluid rushing through the bladder and rushing through the urethra can actually wash out some of the bacteria before they can really take hold in the urinary tract. We want to be sure that we hit that sweet spot with fluid intake. If you drink too much, you can actually stretch your bladder and your ureters and everything so that they don't empty effectively, and you can make the problem worse. So I would see patients coming in my office who were, 5 feet tall and drinking 2 gallons of water a day. And, I'd look on ultrasound and inside their kidneys and ureters and bladder would be all dilated and they wouldn't be able to empty, and they'd be making the problem worse. So just like we want to eat an amount of food that's proper for our bodies, we want to drink an amount of fluid that's proper for our bodies. And so you definitely need to discuss this with your primary care doctor, because you may have medical reasons that you would need certain amounts of fluid or even fluid restriction. But for the average healthy woman, usually it's about half of your weight in pounds in ounces in fluid that you drink. So let's say you weighed 160 pounds. Then your goal over 24 hours of total fluid intake would be, around 80 ounces. And it will vary depending on your level of activity. If you're a marathon runner, you're going to need more. If you're somebody who's just hanging out in the house not doing much, you might need less. But that would be kind of a ballpark to shoot at. So amount of fluid intake is one thing. The other thing that's very important is the bowel activity. If you have chronic diarrhea or chronic constipation, then you're going to have much more bacteria hanging around down there than the average person. So talking with your primary care doctor or your GI doctor to try to get your bowels more normalized would be important. And there's not been a lot of studies on this, but I had really good luck with people taking probiotics. And so I would definitely encourage the patients to talk to their doctor, about using probiotics, because that did seem to be a helpful thing. And then when we're young, our vagina is naturally very acidic. We have high levels of estrogen, and that causes the vagina to be acidic. And so to some degree, that appears to protect, bacteria come out of the rectum and go into the vagina, and then they're killed by the acidity. And then as we get older, we're more alkalotic, and we can talk about that after the break.
Okay, so fascinating information here. Folks, we have to take another break, and we will be back to continue talking about factors that contribute to UTIs.
The pulse of the blood in your veins means you're alive, but a high or low pulse could mean you're not in balance, which could cause problems. But now Patty Conklin has found 3 ways that can constantly make sure your pulse is kept in balance so you can move easier through life. Subscribe to Patty's Healing Pulse today. It has a plethora of things to do, discounts, book club, and so much more. Visit pattyconklin.com to find out more about Patty's Healing Pulse subscriptions. That's pattyconklin.com.
Reach your health and fitness goals. Whether you want to lose weight, learn to dance, build muscle, or just live healthy, Beachbody gives you unlimited access to the nation's most popular fitness and weight loss solutions. Visit our advertiser page and click on Beachbody now.
You may not be in the same room or even the same country, but Patty Conklin's remote energy work can help you heal whether you have an illness, emotional wounds, or are in spiritual turmoil. And she can do it remotely. You can choose your session time, too, starting from 30 minutes, 3 hours, or even 6-hour sessions. Healing energy. Healing you no matter where you are. Visit pattyconklin.com, scroll down to remote healing, and book your appointment now. That's remote healing at pattyconklin.com.
For the best in business class travel, count on Cheapo Air. Cheapo Air has the best price guarantee, 24/7 customer service, and easy booking online or by phone. To experience your hassle-free journey, start by going to HealthyLife.net's advertiser page and click on Cheapo Air.
If you're on pattyconklin.com, you might want to visit her store. There you can inexpensively buy powerful visualizations on a plethora of subjects, all to help you heal, help rebuild your immune system, work with color or tonal energy, help remove fear and depression, and so much more. Plus, you can get Patty's best-selling book at her store, To Be Your Best Too. God Within is a great book to teach you how to use the lost knowledge of the universe to impact your physical life today. Visit her store at pattyconklin.com. You'll be glad you did. pattyconklin.com.
Expanding your mind. HealthyLife.net.
Okay, folks. Frenesa Hall here with my guest, Dr. Martha Boone. And before I forget, if you want to know more about Martha, What's your website?
www.marthaboone.com.
And that's Boone. So you can catch her there, and you can get her books at all the usual places. So when we left off, we were talking about UTIs. You want to just continue on that vein? I mean, it's such a common problem. And I think last we were talking about bowel issues and making sure you get those things cleared up because they can contribute. So go ahead.
So definitely, make sure that you treat either constipation or diarrhea because that can contribute. And then I was speaking about the difference in the pH changes in the vagina. When we're young and have a lot of estrogen, the vagina is more acidic. And then as we age and lose that estrogen, it becomes more alkalotic. The acidic environment is likely to kill the bacteria, which is good for us, and the alkalotic environment is actually makes it a happy place for the bacteria. So a lot of ladies that are postmenopausal, rather than taking so many antibiotics, can be treated with a low-dose vaginal estrogen. And it's something that they would, get from their gynecologist or their primary care. And I think this is something that's really underutilized. So just about every woman, if she has no indication to using topical estrogen, no contraindication to using topical estrogen, should seek that out because that will change the vaginal pH and that can stop the whole cycle also. And then the number one thing that we want to make sure of is that the patient emptying the bladder. After about age 35, women start to get a little bit of sagging of the bladder, which, kind of sags into the front of the vagina. And so without knowing it, we could be having an emptying problem. So that is the one test that women would definitely want to get, a bladder ultrasound, to make sure that the bladder is emptying okay. So with that, I thought we could move on to treatment, if that works for you.
Yes. Like,
okay.
Cranberry capsules. Is that for real?
It is for real, and it took me about 20 years to realize what the issue was. Patients would come in and say, I've cured my urinary infections with drinking cranberry juice, and I go, yeah. So I would recommend it to other people. I'd say, I don't have any science on this, but you might want to try it. And, some of them it would work, some of them it wouldn't. So finally, we have the science. There is a compound called proanthocyanidin, and we shorten it to PACs. And it is the component in cranberry that helps bladder infections. And what it does is it helps prevent them by keeping those little legs on those P. fimbriated E. coli from sticking to the lining of the urinary tract. Now, the various cranberry supplements have different levels of PACs, and so some of them work and some of them don't. And unfortunately, some of the ones with the highest advertising budget are the ones that have the lowest active compound. So I don't have any kind of financial relationship with any of these companies, but I'm just going to tell you the three that I found worked. One of them is called Allura, Ellura. Another is called Theracran, Theracran. And the third one is called Utiva, Utiva. And what the pill needs to have is at least 36 milligrams of these PACs per pill to be able to work. Now, a lot of patients would say, well, why can't I just drink cranberry juice? You'd have to drink about a cup of cranberry juice in the morning and at night to get this same level of PACs. And for most people, that would lead to about a 10-pound weight gain over the course of a year. So you can do it with cranberry juice, but even the cranberry juice with no sugar in it can give you the weight gain. So the easiest thing is probably to get the pills. And they do work. Now, they don't treat an active infection. Once you get an active infection, they're not going to treat that. But they do really work for prevention. I mean, I would have patients that would have a 50 to 75% lower incidence of urinary infections per year just by doing the cranberry. And then in the postmenopausal woman, if you added the vaginal estrogen, I mean, we would see people cured where they just didn't get anymore. So it's worth pursuing that.
And that's cheap, virtually no downside to trying it.
Yeah. I mean, the problem with just going to the urgent care and getting repetitive antibiotics is that the bacteria are smarter than us. So every time we take an antibiotic, what do? They change their morphology so that they are resistant to that antibiotic. And so what happens for a person who just over many years keeps taking antibiotics, you get to a point where we have bacteria that we cannot kill. And so both the patients and the doctors need to be better stewards of antibiotic utilization so that we don't end up causing the patient to have an organism that we cannot treat. So,
right.
Decreasing the amount and the strength of antibiotics that the patient gets is very important for long-term management of this.
Yes, that's certainly a primary care doctor's problem. When clients come in with whatever, and they want an antibiotic as if it's a panacea to cure everything. And I can't tell you how many fights I had with patients, saying that, an antibiotic is just not indicated for what you have. And you have these, ongoing effects in creating resistant bugs that, as you said, we don't have a treatment for. So, and, closely related to urinary tract infections is urinary incontinence. And, being a woman of a certain age, not a lot, but there are several of my friends that have stress incontinence. And that's very common. And, at least back when I was practicing, it's like, okay, you've got to do some Kegel exercises and get the strength of those muscles up. But I don't know, I've not really encountered anyone who had success with stress incontinence doing Kegels. How do you address stress incontinence?
So just to give your audience a little bit of background information, there are basically three types of incontinence. There's stress incontinence, which I think is a terrible name for it, but basically what that is coughing or straining and squirting out, drops or, even a large volume of urine. And the stress part of it is the coughing and the straining. So you're stressing your sphincter by straining your abdominal muscles, and it overcomes that sphincter muscle, and then you squirt out a little bit of urine. The second type of incontinence is urge incontinence, which is where the bladder has like a little spasm and starts going on its own before you're ready for it to go. And then the third type is overflow incontinence. So if you're just leaking a couple of drops of urine, and it's mostly with coughing and straining, then I would strongly recommend going on the internet and looking up a reputable site like maybe the Mayo Clinic or, the Cleveland Clinic, and they should have videos on how to do the Kegel exercises. They really do work, but the problem is people won't do them. And, you have to do like 20 squeezes a day to be able to get it to work. And you have to keep doing it. It's just like any other muscle, that if you stop doing it, then the muscle atrophies and becomes weak. And, so the main problem with the Kegels is that people won't do them. And when we come back after the break, we'll talk about what else you can do.
Okay. So when we come back, folks, it's our last segment, and we will pick up on urinary incontinence.
Patty Conklin is busy, but she's never too busy for you, and there are lots of ways to get a healing session with her. You can even get one via Zoom or by phone. With 29 years in the business of energy healing, Patty has a unique and remarkable ability to connect with your energy to help you heal on a mind, body, spirit level. From angst to pain, you can get help from Patty. Book a half-hour healing session and embark on your own personal healing journey. Visit pattyconklin.com and click on services. That's pattyconklin.com.
If you're looking for unique items at affordable prices, then you should try Dream Product. From apparel to beauty, from shoes to therapeutic relief products, visit HealthyLife.net's advertiser page and click on Dream Products, and maybe your dreams might just come into reality.
Want to get that man or woman out of your mind? How about being in the right state of mind for getting that job promotion or staying positive to help boost your immune system? Want to break those old habits? Then it's time for an emotional cellular cleansing with Patty Conklin. You'll get a private 3-hour session in person by phone or by Zoom with 3 months of follow-up appointments, plus email support. but you'll have to do the work, and homework materials are included. Find out more or to book your appointment, visit PattyConklin.com. That's PattyConklin.com.
Get high-quality glasses, sunglasses, and prescription lenses at eyeglasses.com. Choose from over 250,000 items and 400 brands. Already have frames? Get replacement lenses. It's easy. Go to our advertiser page and click eyeglasses.com.
If you're wondering if Patty can help you heal, why not book a free 15-minute consultation either by phone or by Zoom? It's a great way to see which of Patty's services is right for you. You'll discuss her services in detail and how they can apply to your specific situation. It's really a great place to start, and you can sign up for your free consultation by phone or Zoom on Patty's website, PattyConklin.com. That's PattyConklin.com. Get the help you need today. Sign up for your free consultation at PattyConklin.com.
Radio your way. HealthyLife.net.
Okay, we are back with Dr. Martha Boone, and we left off talking about stress incontinence, and that Kegel exercises were effective, but just like any other exercise, if you want that muscle to get strong, you actually have to consistently do the exercise. So, Martha, repeat for us how you said go to the Mayo Clinic and find a reputable source, and then you have to do the Kegels how often each day?
Probably about 20 reps per day. But, I found so many patients who just could not discipline themselves to do it. So if your listeners don't hear anything but the next thing I'm going to say, then I will consider my time spent with you well spent. The pelvic floor physical therapy people in America are fantastic, and we don't use them enough. There are all these people who are trained in pelvic floor physical therapy. And whether you have fecal incontinence or urinary incontinence or mild prolapse or stress incontinence, they can definitely help train you to, cure this problem without having surgery. I can't tell you how many people would come into my office every day and want to have an operation because they didn't want to take the time and the energy to go to pelvic floor physical therapy. But the ones who would go and who would stick with it, I would say there's an 85-90% success rate. Surgery is wonderful, but it should always be the last choice. If you happen to be the patient that everything heals properly and you don't get infected, well, then that's wonderful. But even in the best hands, with the best surgery, there's about a 15% complication rate. So if you can do something that has a 0 complication rate, it would make sense to do that first. And so pelvic floor physical therapy should be the number one consideration, really, for all incontinent patients, unless you have overflow incontinence. If your bladder just won't empty at all, then pelvic floor physical therapy is not going to help. But for urge incontinence, stress incontinence, and for fecal incontinence, pelvic floor physical therapy really works. Now, some of the other things to consider with stress incontinence is a lot of times that same lady who is postmenopausal can benefit from doing the Kegels or from doing pelvic floor physical therapy along with topical vaginal estrogen. There's a lot of evidence in the scientific literature that the topical estrogen strengthens the tissues around the urethra so that you have actually something better to work with. And even when I was going to operate on people, I would ask them to use the topical estrogen for 6 to 8 weeks before we did surgery because a lot of times they would get a better surgical outcome also. And then, men who have incontinence after a prostate operation, they can definitely benefit from pelvic floor physical therapy also.
Excellent. And, the whole vaginal estrogen, those tissues, as you know, get dry and fragile. And so it makes perfect sense that you would want to beef up those tissues before you're going to go cutting on things. So pelvic floor PT. Now, when I was in practice, I don't even think I knew about pelvic floor physical therapy. Since then, I actually have a friend that is a pelvic floor physical therapist, but I'm imagining that most of those referrals are coming from urologists and not so much primary care.
Well, the doctors are not referring to them at all. And, I don't understand it, because in Europe, whenever a woman has a baby, they start the pelvic floor physical therapy before they ever even, deliver. And in America, we don't refer to pelvic floor physical therapy much at all, which is very unfortunate. But there are a lot of really good ones out there. And if your listeners were to have trouble finding one, then whatever is the major hospital that does a lot of OBGYN in their area, they should know who the good pelvic floor physical therapists are. And, in Atlanta, we've got one just about on every corner, and I know all of them, and they're just amazing folks. But I think the patient should really, really push for this. And in some states, people who are on Medicare can actually self-refer. They don't even have to get a referral from their primary care doctor. And I don't know how that is in all states, but in Georgia, I believe Medicare patients can self-refer to physical therapy. So that's an important thing to remember too.
That's excellent. But the primary care doctors, we're quote unquote gatekeepers, and so a patient could go and get your book, Unfettered Urologist, and go to their primary care doctor and ask for a referral for pelvic floor physical therapy. I think that alone would be so beneficial, and definitely, surgery is a last resort. As you said, and I want to repeat this for folks, you said that surgery, even the best, still has a 15% complication rate versus pelvic floor physical therapy that's 0. That, to me, is a reason enough to start with pelvic floor physical therapy. Primary care doctors have a lot of things to cover. And as I said at the opening, I wish I'd had this book when I was in practice, because I learned so much about these common issues that I encountered, and obviously telling someone, do some Kegels, was not an effective, not effective advice. And clearly, it's got to be an exercise routine. And I imagine that with pelvic floor physical therapy, you're going to get sent home with exercises that you need to do and maintain. So the book is The Unfettered Urologist, What I Never Had Time to Tell You in a 15-Minute Office Visit. It's available everywhere. And then MarthaBoone.com if you want to know more about Dr. Boone. And we have just a few minutes left. Tell me what's on the horizon for you. You are not someone to sit around and be idle and just go fishing while you're on vacation. Although when you do, you got to call me, because that's. But so tell us, what can we expect from you or look for?
Well, I'm writing 3 books, which it takes a few hours a day to do that. And I'm trying to take care of myself. I'm sleeping. I'm trying to eat those vegetables. I'm trying to exercise. But one thing I did want to say to your listening audience, the power of this book, The Unfettered Urologist, is to give them enough quality information to be able to ask the right questions when they go to the doctor. What happens is most patients show up at the doctor, and they don't even know what to ask, because there's just a plethora of low-level, low-quality information on the Internet. So they come in confused instead of knowing what to answer. So if you have a common urology problem, the book can help give you quality background information so you know what to ask when you go to the doctor, and that's the power of the book. But as to what I'm doing, I'm still getting a lot of calls from patients and nurse practitioners and PAs, so I do spend time doing that. And, taking really good care of myself, it's time-consuming. And
it's a full-time job, isn't it?
Yes. And for those of you who really want to know the down and dirty truth about Dr. Frenesa Hall. She's my husband's fishing buddy, and the two of them like stay out all day fishing. So just so you know a little tidbit about her that you might not find out from the other guests.
Yes, he is my fishing buddy, and we had such a great time going out fishing. We had some tall tales to tell when we got back. Of course, I had to pry myself out of the boat because I've been sitting hunched over for so long, but that was a great time, and we are definitely overdue for getting together. And, you know, time flies, and we've got to sign off. But thank you so much for being my guest. And, folks, go get the book if you're having any of these issues. And actually, there are other issues we didn't even cover. And, you know, get that information and be educated and be your own advocate when you're going to your doctor. So thank you so much. Next week,
thank you for
Susan Kramer, homeopathist, herbalist. It's going to be a great show. Martha, thank you again. Really appreciate you being on the show.
Thank you for having me. I hope someone will be helped with this.
I'm sure that people out there, because these problems are so common, that there are people out there that are going to really benefit from this. And we all know someone who has one of these problems or multiple. And so share this information. It'll be tomorrow. It'll be up on the website, and you can listen on demand. So if you're out there and you have friends that have these issues, you know, send them the link to the show so they can listen to this show, or get them the book as a gift. But, you know, I think anything that we can do to help people, you know, be their own advocate and stand up for their health and be actively participating in their health is a big benefit. So thank you for writing the book, and thank you for being on the show.
Thank you.